Okay, so the topic for the journal 4 for unit number 4 is suicide. And the three questions which the instructor asked is what is the stigma related to the suicide? And second question is if there is any personal experience with a patient of suicide. And third question is how you will address the stigma. So, suicide stigma is it is related greatly with the suicide risk, with a higher level of suicide risk, and with also some if somebody has very poor mental health, and if there is help seeking is lowered, or if there is a grief related difficulties. So they all related with the suicide stigma. Regarding the personal experience, um, in the United States, most of the cases of suicide are either because of the job loss or either because of relationship failure. And I have seen patients in my med surg floor having suicidal thoughts and ideation. But usually, behind every patient, in their profile, there was a history of some mental health problem like depression or drug abuse. Uh, in friends, I have seen a woman who was having a suicidal tendency, and she showed me the suicidal ideas and thoughts because of the relationship failure. Um, what we can do about these suicidal stigma and thoughts and ideation, we can always educate the patient, we can always train the patient, we can always work with the chemistry of the brain. Is there any problem with the neurotransmitters, especially in cases of the depression and refractory depression, which is depression which is refractory to the treatment? We can address those problems that are putting the patient at the suicidal risk, and by treating the mental health problem either through the pharmacological management or non-pharmacological management, or in cases of the refractory depression, which is a risk factor for the uh, suicide, we can like use CBT, like cognitive behavioral therapy, and we can also use ECT, which is called electroconvulsive therapy. And there are a lot of other behavioral modifications, and there are a lot of other dietary modifications we can do to bring the serotonin level up. So these patients can have balanced neurotransmitter, and their suicidal tendency can decrease. Thank you very much, and you have a nice day.